Dear students, we'll discuss a case scenario which is very interesting. Maybe get as a short case or long case in the exam. We'll have some differential diagnosis. The important thing is clinical examination is very, very important in such patient. Otherwise, we'll miss a full clinical entity as such. That is why this clinical condition is important. Remember what this clinical condition is. Look at that. Here you can see that lymph nodes are there in the probably swelling is there, but they are probably lymph nodes very hard compared to the opposite side, right side. See that very big, touch your skin big. You have to always check the skin free or not, probably involved. Then mobility, fixity, then size, measure the size, shape, surface, nodularity, their consistency may be hard, like that. Distal pulsation you have to check, and venous edema is there because compressors there. And above external iliac lymph nodes also you have to check above and medially, because if this lymph node that may get involved. Systemic examination you have to do liver and lungs, suprachiasmal lymph node, and bone, brain, all other things. Assessment once you think of malignancy, probably if it is so, malignancy, tuberculosis, these are the other possibilities you have to think of. So what type of malignancy also you have to think of. So this is probably nodal swelling. Other than that, if it is not node, probably soft tissue tumor, maybe soft tissue sarcoma after that. So duration is important, history is important, fever is there or not, how it is started, how it is progressed. If it is short duration, progressed, probably malignancy. Whether it's a lymph node, if it is lymph node, what it is, maybe secondary is lymphoma, tuberculosis, it's a benign, but malignancy you have to consider. Otherwise, sarcoma, like that. So that's how exactly your brain should think in a swelling like this, so to analyze what exactly eventually it could be. So it's a large right side inguinal nodal mass, probably secondary in the node. So lymphoma and tuberculosis, lymphoma, tuberculosis secondaries, lymphoma, tuberculosis secondaries, any nodal mass. First three conditions which you have to remember, whether it's a neck, axilla, or in the groin area. So these are the three conditions you have to remember always as a differential diagnosis. Then of course, eventually it comes to only one area. Then what is sarcoma or other conditions will come into the picture. First three conditions has to come immediately into your mind to differentiate. That is the point which I want to stress actually. So thorough clinical examination is essential. That is what you have to require. And see that when you examine such patient, see if you don't check the soul, primaries here, the typical pigmented lesion. So patient sometimes may not be worried about, because nobody examines their soul regular day-to-day basis. Even I don't see my soul so more often. I just wash and clean, but I want to observe. So same thing happened to the patient. Patient observed this one, then might not have known at all this pigmented lesion which has got some significance. So if the primary is here, look at that pigmented lesion which is called secondary. So if you don't examine this one, then entire thing will be missed. That's why thorough clinical examination I have put. Very, very important patient like this. So primary melanoma in the soul causing secondaries in the groin, which is quite extensive actually in the lingua and the lymph node. And so you have to assess the metastatic workup, local assessment you have to do. Then excision biopsy, no incision biopsy for the melanoma, remember. And clinically no induration. Unlike squamous cell carcinoma, there is always induration. Epithelioma, otherwise called as. Whereas melanoma, no induration and no incision biopsy. These are the 2 points you have to remember. And excision biopsy is the initial evaluation method. Then of course you got a class grading and breast close staging. Breast close grading, class staging. Mainly breast close grading is very, very important. Depth is the most important thing to grade and stage the patient and plan the treatment and have the idea about the eventual outcome. So excision biopsy, not incision biopsy. Again, I'm repeating, telling, because it's asked in the Viva, they will ask, in MCQ they will ask, Oxy they will ask, theory when you write also you should know. So showed pigmented lesion right soul suggestive of melanoma with right ileal nodes. Secondary to no induration in the primary lesion. Already it was very typical for melanoma, remember. And excision biopsy is ideal. Excision biopsy of primary, remember, not lymph node. What I meant is for primary, not for the lymph node. Excision biopsy of the primary which you have seen in the soul. That is the excision biopsy, not for primary. Primary, not for secondary. Secondary, FNAC only. Excision biopsy of primary. FNA is not the secondary. Secondary you don't excision biopsy, you do only FNAC and confirm it is in node. Naturally, mostly in this patient like this, such a large nodal mass, it is involved definitely, but you have to do FNAC. But excision biopsy for the primary, I am repeating, don't get confused. FNAC of the lymph node mass, I already mentioned here. Metastatic work of CCT, abdomen, pelvis, groin, chest. PET CT is ideal in this patient because large lymph node is there. And tumor markers, again MCQ question, Melanoma, HMG45, LDH, and S400. These are the 4 tumor marker very commonly used for melanoma. Remember. So treatment I already told, wide local excision, amputation if it's extensively involved, organ removal like whatever the organ it is involved, alveolar node dissection is important, chemotherapy like diethyl triamine, immunocarbazine, DTIC it is otherwise called as melphalan, melphalan for melanoma. That's how we used to remember during our PG and UG period. CVD regime, biochemotherapy also very. There are so many therapy, targeted therapy, isolated lymph perfusion or infusion. Find out all these meanings of this because it is very aggressive. Aggressive skin cancer is melanoma. BCC is the commonest skin cancer, but it is not aggressive. Squamous cell carcinoma is in between, again not as aggressive as melanoma. Most aggressive melanoma is a systemic disease, causes spread to the liver, large liver, massive hepatomegaly is common in melanoma primary, and eye involvement can occur. Brain, lips, lungs, bone, everywhere it can involve. It can be metastatic, whereas BCC is locally malignant. Squamous cell carcinoma is loco-regionally, mainly lymph node is not, systemic spread is not common. Whereas melanoma has got high propensity for systemic spread as well as nodal spread. So if melanoma is aggressive, BCC is locally malignant only, less aggressive, curable malignancy. One of the curable malignancy is probably BCC. Squamous cell carcinoma is loco-regional disease with the lymph node, but systemic spread is not common. So 3 malignancy of the skin, 3 different behavior, biological behavior. That's the point you have to remember briefly actually. So for detailed understanding of anatomy of skin, classification of skin tumors, and BCC, SCC, and melanoma in detail, please read my SRB's manual of surgery and also DigiNow lecture through JP. It has given detailed lecture of that about the same thing by me. So remember, it's aggressive tumor. I already told depth of invasion, not much role of radiotherapy, different methods, differential diagnosis, everything. So again, please go through my manual of surgery, subscribe my YouTube. Satellite nodules in melanoma occurs within. Answer the MCQ, put it in the comment box. I will acknowledge and appreciate your answer. So find out what is right, 1 centimeter, 2 centimeter, 2.5, 3 centimeter. Dartmouth regimen is used for BCC, squamous cell carcinoma, malignant melanoma, skin adnexal tumor. Again, put the right answer. I'll get back to you. And quotation of the day is, learn from your mistakes, you will become wiser. So once you have done the mistake, don't repeat it. That will be death-threatening to you always. So, but remember that you have done some mistake, don't repeat it. So you become wiser. That is the meaning of the quotation. Students, please go through my SRB's manual of surgery, SRB's clinical methods in surgery, and SRB's operative surgery, surgical atlas. The new edition has come, and atlas of steering technique. Manual gives everything in detail about all topics as per CBM syllabus: general surgery, gastrosurgery, urology, neurosurgery, cardiothoracic, and basic instruments, specimens, brief operative surgery, which is essential for UGs. Everything is covered with the quotations, with the illustrations, diagrams, photos, covered everything as for CBM syllabus. And clinical methods in surgery, current edition gives a proper clinical idea, approaches to all cases, briefly orthopedic also. Again, it contains instruments, specimen, images also, and videos. Each chapter videos are there how to examine a patient, which is very important when you do a practical exam, clinical exam. So very, very useful, everything, with again, lot of photos and proper methodology of examination with the differential diagnosis tables are given. So it will be very, very useful. Of course, operative surgery is a very detailed 2-volume extensive book with more than 10,000 photos and illustrations. Whenever you want to, any surgery, including specialty, general surgeries, gastrosurgery mainly, in detail it is given. It will be very, very useful. So students, also go through my SRB's Surgery Insight YouTube insights, and please subscribe for all these lectures, daily lectures for brief 6 to 10 minutes, and live sessions once a week or once in 2 weeks I am doing. They're also very, very useful for students with with the interaction with the senior faculties are there, and always they can answer your doubts and through chat. So please subscribe my channel, YouTube, Instagram to have a better knowledge and increase your surgical knowledge as such, because it is free also. And my DigiNow lectures through JP, around 220 lectures covering everything surgery, including specialty, operative surgery, clinical methods also, with the videos through JP Publishers. And you can always purchase that one for 1 year, so that you can have go through all lectures, so have a very clear idea about the subject to face any exam, including NEET or final year exam or even PG exams. I hope you understood this lecture very well. Thank you so much.